Dental therapy is a relatively new innovation in healthcare that could increase access and reduce costs. If North Carolina wants to pursue this option, it would be good to know more about how it works, and that's why we welcome to the program Christy Jo Fogarty. She is the first advanced dental therapist in the country. Welcome to the program.
Thank you for having me. Appreciate it.
So you started with this dental therapy in Minnesota, is that correct?
Correct. Minnesota was the first state to codify it into state law. Of course, there's been dental therapists in some form in Alaska for coming up on 15 years now. But Minnesota passed their legislation in 2009, so the legislation is just this month 10 years old. But practitioners have been out there for about 8 years.
Before we get into the details of how it works, of how it worked in Minnesota and why it's important, remind folks, how is dental therapy different than what they think of as going to the dentist's office?
Sure. So a dental therapist is, we compare ourselves quite often to nurse practitioners or physician's assistants, sometimes called a mid-level provider. And we really work as like an extender for a dentist, one more member of the dental team. We can do any kind of filling, stainless steel crowns on both adult and permanent teeth. We can do extractions of primary teeth and of limited extractions on adult teeth. So we really help to expand the dental practice for the dentist.
More than a hygienist, less than someone who's got the DDS degree, I guess.
Correct. I am also a licensed hygienist, but not everyone is in the state of Minnesota.
Why is this something that you see as a helpful addition in a place like North Carolina that might look into this? How could it be helpful to add dental therapy to what we already have?
Sure. Well, one of the things that's been recognized nationally is that there is a shortage of dentists. Some is a little bit of a maldistribution, but some of it is a genuine shortage. We're finding that about for every 3 dentists that are retiring, as our baby boomers retire, we only have about 2 dentists coming out of dental school. And unfortunately, that means that there's already a shortage, and now you add into that people are keeping their teeth longer, they're wanting their teeth healthier, and people are living longer. So there's a huge market out there that maybe didn't exist 100 years ago that certainly exists now. So you have a shortage in a profession, and this is really a way to help expand that. In addition, you have this group or population who really struggle to find access to dental care for many reasons. One is they're on public assistance programs that aren't accepted or have limited access to dentists. They're uninsured, and it's priced right out of their range. And dental therapists can help dental offices kind of open up and close that access to care issue.
You've been working as a therapist now for how long?
I've been a dental therapist coming up on 8 years in August, but I've been in dentistry for 25 years. I started out as a dental assistant back in 1995, practiced as a dental hygienist for 12 years before entering into the program as a dental therapist.
How did things change after you went from being an assistant to a hygienist, but then especially from hygienist to now therapy? How were you seeing the same patients basically, just being able to do more?
For me, that's exactly how it was. I wasn't someone who worked in public health, and I moved from a private practice into public health. I actually moved from independent contracting, really temping myself out into dental therapy. So for me, it has been such a rewarding experience to provide more and more care for all of my patients.
We are chatting with Christy Jo Fogarty, who was the first advanced dental therapist in the country. She operates out of Minnesota, as North Carolina is starting to look at the possibility of making dental therapy available here. When you deal with a particular patient, how much of their dental needs are you able to deal with? Are you, for many patients, able to take care of anything they need?
Sure, I'm fortunate that I get to work in pediatric dentistry, and dental therapy is very much geared towards pediatric dentistry. We of course can service anyone, birth to death. But for me, because of the scope of practice allowed in Minnesota, I really can do almost everything, and I do frankly do everything that our dentists can do in our practice because they refer out the things that I wouldn't do either. We don't do a lot of oral surgery. The only thing that I don't do that our dentists provide is in-hospital care for those that are very young and have a significant need, and they need to be put under general anesthesia to have their work done. But I can take out any primary teeth. I can do all of their stainless steel crowns. I can do any kinds of fillings. I work for an organization called Children's Dental Services, and we see children from birth until age 26 and pregnant women. So for that population, I can really do just about all of the services that our organization provides. Of course, if I were in a private practice, I would not be able to do implants, crown and bridge, oral surgery, things that are of a much higher nature and that I've not been trained to do.
We've heard that one of the sources of opposition to making dental therapy legal here in North Carolina would be from dentists. How do dentists in Minnesota respond to having these therapists?
Well, I can say today the dentists in Minnesota have been are fantastic. But you also remember now we have 8 classes of dentists that have gone through school with dental therapists, and they understand as they train side by side with them that in their scope of practice they've been trained to the level of a dentist, and they really understand the role a dental therapist can play in their practice. So that's been really fantastic for the state of Minnesota. Of course, I started when there were no dental therapists in practice, and it was tough. It was tough for them to understand how our role would fit in. There was a great deal of opposition. People concerned. I, in fact, worked with a dentist who was in dental school while I was in dental therapy school, different schools, and she had been told by her professors that these dental therapists will take your job. And she ended up being a huge advocate for dental therapy once she really realized we are nothing but an extender. We're a part of the team. We're not here to take anyone's jobs. We're here to help their job be easier. So we've seen a huge, huge turn in Minnesota. I think from a great deal of opposition to a great deal of acceptance. We find that the number one person who wants to hire a dental therapist is someone who already has a dental therapist working for them. Once they understand how they fit into the practice, they really, really want more dental therapists working.
Have you found this far along that the dentists see that, when the dental therapist is working on these issues, I get to work on other stuff too that only I as a trained dentist can do?
Absolutely. I had the opportunity to sit on a panel with a gentleman named Dr. John Powers. Unfortunately, he has since passed away, but he would tell the story of how he had sent his dental assistant to become a dental therapist. He just wanted to service his community more, and he said he really wasn't interested in her making a ton of money for the practice. He just wanted to be able to service his community. He had a high population of people who were on public assistance, and there was no one else who was willing to see those patients, and he couldn't see as many as he wanted. And he said at the end of the first full year she had worked, she had made the practice $20,000. So paid all her expenses, paid her assistant, all her benefits, and he was thrilled with that. And one thing he hadn't anticipated, though, was he was able to do more implants that year than any other year previous and more root canals that year. And as a result, the practice made $200,000 more. And these are patients that are widely public assistance patients. So for him, he was able to really build that private piece to really help support that public piece. And in his case, it financially, and he would talk so much about how you can serve the public and still make a dollar.
In the brief time that we have left, North Carolina is just starting to talk about this. Does this make sense? Should they follow through and try to make dental therapy a part of the scope of practice?
I think that any state that has areas where there are members of your population struggling to get access to dental care, this can do nothing but bring positive results to your state and to your communities. So, if I had my druthers, every single state in the union would have dental therapists allowed to practice. Of course, North Carolina needs to look at what's best for North Carolina, but I suspect if it's like many of the states, those rural areas really struggle to even get dentists. And if dental therapy can help bring access to care for those people, I think North Carolina needs to look at it seriously.